Hello, my name is Jaron Bighorn. I'm a senior at Red Cloud Indian School in Pine Ridge, South Dakota, on the Pine Ridge reservation. And my question is, on the reservation, there is, I'd say, like exceptionally high suicide rates for young Native Americans. And I was wondering how, we can solve this problem, what types of things you would recommend or implement, I guess, to help support these poor communities and their young people and their struggles growing up in this stratified society.
So I am a clinical health psychologist by training. And so when you ask a question about mental health, it strikes a particular chord for me. And we know that the rates of suicide and suicidal ideation is particularly high among American Indian youth. This is a crisis in and of itself. Mental health and the prevention of mental illness is a priority. And I think in the sciences, and particularly in mental health, we need to ensure that there is access to culturally and community competent services. We need to ensure that we reduce the stigma around asking for help, which can be really difficult for young people to do, to make that reach out in enough time to provide services. I think the good news about mental health is that with appropriate treatment, we can manage it. And many of the psychological, psychiatric conditions can go into a state of long-term remission, and we can heal. I think we also have to get to the root of the problems, particularly when you think about, young people who are on reservations and who are living in very challenging circumstances. We have to get to the root of the problem. And those problems are often very complex and require complex solutions. But we do have evidence-based treatments and interventions that can work and that are culturally appropriate. And the key is to ensure that we are able to bring those into the communities with the highest need. And that's where I think we have the opportunity to save lives.